Hi, you guys. Welcome back for our daily practice questions. As always, I'd like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, flashcards, Q banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always go over my disclaimer reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 32-year-old woman presents with a history of recurrent headaches that are often associated with nausea, vomiting, and sensitivity to light. The headaches typically last 4 to 72 hours, and she experiences visual or like flashes of light before the headache starts. The headaches are unilateral and throbbing in nature. What is the most likely diagnosis? Is it A, tension type headaches, B, cluster headaches, C, migraines with aura, or D, temporal arteritis? Take a moment and tell me what you got, you guys. All right, so I always recommend reading the stem of the question first, as the stem of the question allows you to slow down to ensure you're answering what is being asked of you. Now, here, the stem of the question states, what is the most likely diagnosis? So, I tell y'all, if they're asking for a diagnosis, you need to run it back and look at the assessment findings. How did they present? What are those signs and symptoms? What are their chief complaints, right? Make sure you identify if they're telling you the age, the gender, and also if they include the ethnicity, because sometimes this tells you how to treat as well and contributes to some diagnoses, right? So here's a 32-year-old female. She's coming in because she has recurrent headaches, often associated with nausea, vomiting, sensitivity to light, aka photophobia. Um, and the headaches are unilateral and throbbing in nature. What do y'all think about this? This is classic presentation of C, right? A migraine with an aura. Question number two, a 45-year-old male presents to the clinic with a severe migraine headache that has lasted for the past 24 hours. He reports nausea, vomiting, and light sensitivity. His blood pressure and vital signs are stable. He has tried over-the-counter acetaminophen and ibuprofen without any relief. What is the most appropriate next step in the management of his acute migraine attack? Is it A, to prescribe a triptan, B, prescribe acetaminophen with codeine, C, administer IV fluids and corticosteroids, or D, refer to neuro? Take a moment and tell me what you got. All right, so here, stem of the question states, what is the most appropriate next step in managing his acute migraine attack? What is the best next step? So what's going on? So again, it's talking about treatment. So I always tell y'all, if the stem is asking you about a treatment, you want to make sure that you are looking to see if a diagnosis has been provided, right? And if they have not provided you with a diagnosis, you need to take it a step further and identify um, the assessment findings so that you can determine the diagnosis. But here it lets us know this is an acute migraine attack. And the key word acute is big here. I always tell y'all, if they say acute, if they say prophylactic, pay attention to all of those things, right? But this patient has tried over the counter management. It's an acute attack. Our first line therapy are triptans, right? Prophylactic, you would have gone a different route. You could have used things like propranolol, Depakote, Elavil, things of that nature. But we're talking about an acute treatment, and we know for acute management, triptans are first line therapy, okay? And then lastly, question number three, a 38-year-old man presents with a history of severe unilateral burning pain around his right eye. The pain is excruciating and it occurs in episodes lasting about 30 minutes to 2 hours, often occurring at night. The patient reports associated symptoms of lacrimination, rhinorrhea, and ptosis, right? I always jack up all of these terms, but basically, um, tearing as in watery eyes, rhinorrhea, the nose running as well, and drooping, right? So know that I put these terms, even though they twist this Southern girl's tongue every time, but I put them in there for your benefit so that if you see them on boards, you know it either way. Okay. But yes, um, lacrimation is just like that. Tearfulness, the rhinorrhea, basically runny nose, runny eyes, and drooping of the eyes during the attack. So letting you know that as severe as that eye pain with these headaches, they're having all of these symptoms as well. Okay. His physical exam is otherwise normal. What is the most likely diagnosis? Is it A, trigeminal neuralgia, B, cluster headaches, C, tension type headaches, or D, acute sinusitis? Take a moment and tell me what you got. All right. So, stem of the question, what is the most likely diagnosis? So, again, if we're looking for a diagnosis, we're going to run it back and look at those assessment findings. We have a 38-year-old male, have a history of severe unilateral burning pain around his right eye. The pain is excruciating and it occurs in episodes lasting about 30 minutes to 2 hours, often occurring at night. He's having tearfulness. He's having running nose. He's having drooping of the eye during this attack. What is this, y'all? So this is classic of a B cluster headache. Cluster headache is that one that they say that pain is so excruciating severe that these patients can have suicidal thoughts. Like that's how intense it is. It's often directed specifically to one eye. So unilateral eye pain is the predominant chief complaint from these patients. And with this, it's so intense. That they need management. They talk about it from 30 minutes to 2 hours. So all of the key um, identifiers that you need to know for cluster, and working your way through it. Even thinking about tension headaches. Remember, your tension headaches are those band-like headaches, right? I say think about rubber bands, tension. We put tension on rubber bands, so you have band-like headaches. Cluster headaches is that one that all the pain clusters up around the eye is how I look at it, and it's intense. Okay. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all know what to do. Y'all meet me back here. If you need any other resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. The things that I do offer are my review book. You can get it in an ebook or paperback option. They're both linked in the bio of this channel. If you are someone who prefers to study independently, my self-paced review is also linked in the bio of this channel. If you're looking to complete any practice questions to gauge your application, my QBank options are linked in the bio of this channel. If you're looking to book any one-on-one sessions, I always say either call, text, or email, as I offer a variety of one-on-one session types. And I like to speak with you to gauge what you truly need to make sure you're booking the appropriate session. And then lastly, if you want to get the flashcards, they're linked in the description of this video. All right, y'all know what to do. Make sure you meet me back here. Happy studying. Bye, y'all.